of other health issues, including measles cases now at their highest level in 35 years. The CDC says only 10 U.S. states have measles vaccine coverage rates above the 95% threshold in the prior school year. That is so key because that is, as you know, a marker for basically a way to stop transmission, herd immunity. Do you believe that the federal government needs to make a really full-throated push to tell parents, go get your kids vaccinated with the MMR vaccine?
You know, one of the first things I did as CDC director, I think it was back in February of this year, was that there was a big outbreak in South Carolina. And I went on, I don't know if TV is the right word, but I went on camera and I recommended that the best way to end the measles outbreak there was to have their parents vaccinate their kids for measles.
Yeah.
And the outbreak has now ended in South Carolina, in part because of that. There's been a lot of outbreaks, not just in the United States, but around the world.
Yes.
And you know, a lot of that has to do with sort of a collapse in sort of public trust in a lot of public health measures that occurred during the pandemic for reasons we can discuss. For me, the most important thing is to try to regain that trust.
Right, but why not? You can have TV ads. You can have something that's more of a national push. It was notable last week that Secretary Kennedy went on television and did say parents should get kids vaccinated for measles because it's effective at preventing infection roughly 97% of the time. That was a change for him. He has not always been that clear, as you know. Why not blast that across the airwaves of America? I
mean, I think that I've done my best to try to do that. Every time anyone's asked me about vaccinating for their kids for measles, I say exactly that. The best way to protect your kids from measles is to get the vaccine for measles.
This country's going to lose its measles elimination status in November.
As did Canada, as did Mexico.
But that's not
UK.
Accessible, right? For gold standard science.
But you know, I think the thing is if you look at the actual what's happened, like there's specific states where you've had these outbreaks. Big outbreak in Texas, which has now been addressed. Big outbreak in Arizona and Utah that's been addressed. South Carolina that's been addressed. Now what we saw was an outbreak in Virginia, again coming down sharply, and now Pennsylvania. It's specific communities of people that are the highest risk that we have to focus on, as well as the broader sort of message that it's important for children to be vaccinated for the measles if we want to address the measles outbreak.
Well, that's why I brought up herd immunity, because it puts everyone at risk, right? Not just people.